Welcome to Realizing Resilience, a podcast from the Connecticut Women's Consortium. We're not behavioral health professionals, but we're your gateway to real conversations with the experts. Each episode, we'll delve into the vast landscape of mental health, from personal stories to expert insights. Together, we'll bridge the gap between clinical expertise and personal experiences, connecting with diverse voices and perspectives. Join us for insightful conversations that demystify the world of mental health.
Dr. Iyanna Liles, FACOG, graduated from Duke University in 2010 and completed her obstetrics and gynecology residency at the University of Connecticut in 2018. She specializes in gynecologic care and minimally invasive surgery at Comprehensive GYN of Connecticut and provides obstetric services at St. Francis Hospital and Medical Center. Dr. Liles is also an assistant clinical professor in obstetrics and gynecology at Quinnipiac University and Yale University School of Medicine. She is actively involved in advocacy and volunteer work, particularly with the Connecticut Maternal Mortality Review Committee. So today I have Dr. Liles with me. Thank you so much for joining me.
Thank you. Appreciate it. Glad to be here.
The first question that I have for you is, so you specialize in gynecologic care, like routine gynecologic care and minimally invasive surgery. Your special interests are family planning, adolescent health, advocacy, and health equity. So how do those things contribute to healthcare outcomes and improving them for Black women in the community?
For me, this all goes back to my interest in becoming an OBGYN. I learned about reproductive health while in college, and especially the disparity amongst Black women and the forced sterilization amongst Black women. And I remember that I refused to let anybody tell me anything about my body that I wouldn't be able to figure out on my own. And so that's what led me to become a doctor and to become an OBGYN. And so to that point, I specialize in all these things because in my mind, if I can be an honest and knowledgeable clinician to my patients, I can help them make informed healthcare decisions about their bodies. And so to me, by doing that, it also can help improve the health outcomes because as people are more participants in their healthcare, it helps them to feel better and to get better when they're active participants and someone's not just telling them what to do. So I think by being knowledgeable and being honest about it as well, there are certainly times where I meet patients and they want to do something and I may not feel like it's the best for them, but I still want to honor that what they think is important. And so I think being honest and building that rapport with patients has helped me to be able to help people make a decision they're comfortable with. And as long as to go with them on the journey to the place where they're ready to do certain treatments or procedures they may not have considered. The other thing, about the work that I do is I really like to give patients autonomy. I think being active in your own care and making your own decisions is important. I love to tell people that, you're going to go home with your body. I'm not going to take it home with me. I'm going to go home and do whatever I need to do. And so you have to feel comfortable with your decision. And so if you're okay with it, I'm okay with it as well. And so I think having that autonomy and that empowerment to making decisions, I think is really what's going to turn the tide for Black women, for anyone to have, the appropriate health outcome that they need. And then the last thing is listening to patients. I think there's a lot of value in spending time. Sometimes patients, have been to different clinicians and may feel that they haven't been listened to or heard, and giving them the space to be able to talk and about whatever's going on or whatever they're concerned about, I think is therapeutic and helping to improve their outcomes in the long run.
Empowerment is such a big piece of it.
Correct.
You also do some activism and advocacy work. So I saw you in the Reproductive Justice Alliance meeting recently. And then you're involved with the American College of Obstetrics and Gynecology. So how do you think advocacy plays a role in this, in addressing those disparities, and how is advocacy part of your practice?
There's a saying that if you're not at the table, you're on the menu. And I am a firm believer of that. People are making decisions about a person's healthcare without any input from someone who's knowledgeable about that decision that's being made. And so for me, it has been a lifelong goal/dream to be at the table when it comes to reproductive health care, especially because I'm a woman, I'm a Black woman, and I don't want anyone making decisions regarding my body that I didn't get to say in. So I think of my advocacy work as my way of getting to the table and creating a voice for my patients, for my profession, and for myself and for my loved ones. And so through that, I've been able, as you mentioned, through the various organizations, have had the opportunity to do different advocacy outlets. And so, the way I incorporated that into my practice is, number one, in my exam room, I try to make all my patients advocates. I love to tell doctors, even if you don't go to the Capitol, you are an advocate by one, providing excellent care to the patient and speaking up for them. And so that may mean I call insurances and I have to yell at them or do the prior authorization. I'll sometimes get patients involved and say, hey, you need to talk to your legislator in your town or your federal legislator. They actually want to hear what every patient has to say. And so I think if someone's going through something, I'm like, hey, oh, that didn't cover it. You need to let your senator know, because I bet you they will make the hospital move mountains. So that's how I like to get patients involved and how I try to do it in the practice. Now, outside of like my actual clinical work, I go to the Hill, I lobby, I will write to legislators, I will use social media outlets, even though I don't do it all the time, but that's like the new trend. I've gone to DC, I've been down in Hartford, and I will bring stories of patients de-identified. So no, they can't figure they shouldn't be able to figure out who it's about, but I will bring my patient stories, the concerns people are telling me, and then I'll hear them say, wow, I didn't know that's happening. And I'm like, I hear it all the time. And so to that point, I think that the way that we are going to be able to address maternal mortality, the morbidity, any health outcomes, is we have to let the people who are in power know what's going on. And we have to then fight for it, because they are hearing a lot of other noise and a lot of other things pulling them in different directions. And if the people who are significantly impacted by their decisions don't speak up, it's going to continue to happen. And I think that's how we've kind of gotten to this place right now, is that the squeaky wheel gets oiled. A lot of other squeaky wheels were louder than us. And I think only now are people starting to get louder in their squeak so that they can be oiled.
Yeah, I really admire your tenacity. I think that's so admirable, because I think a lot of patients, I mean, obviously with their own providers, feel like they don't really have a voice or that they don't know enough to talk. But I can't imagine on like a statewide or a national scale, if you don't feel like you have power in that siloed situation, like
Correct.
how are you going to be brave enough to speak to the general public?
Correct. Having a doctorate, having an MD behind my name gives me that sort of legitimacy to be able to say, no, these are the people who come and speak to me. And countless times throughout the week are telling me they're scared that this is happening, that the insurance is doing this denial. What are we going to do about it? Because if this were your daughter, mom, loved one, how would you feel and what would you want done? And I think we bring perspectives that way when we as physicians go and bring those stories. But I also tell patients, hearing it directly from you, as much as they love to hear from me, if they can put a face to a name, a person who's brave enough to put it out there, that is how legislation gets started, is because one person spoke up, or a group of people, someone spoke up, made enough noise and made a significant, for whatever it worth, and it got to someone's attention to the point where they were able to make, a law or bring it to the attention so that we could vote on it or something like that.
So speaking of legislative activity, you also are one of the physicians who provides feedback to the Connecticut Maternal Mortality Review Committee.
Correct.
So what suggestions have you made to them, and also what state actions have they taken?
The Connecticut Maternal Mortality Review Committee. It's a multidisciplinary group of individuals. So there's physicians of different backgrounds. It's not just OBGYNs. There's nurses. We have mental health clinicians. There's also state agencies. So there's DCF and there's the DPH and different community health organizations. And what we do is any person who dies during pregnancy or at postpartum up to a year, we review the deaths and make recommendations. And I can't say all of the things I've done because it's technically supposed to be a secret, but in particular, what I like to focus on from the physician side of things is, one, where could we as a physician have intervened in that person's care and prevented that death from occurring? I think that that's a very valuable information, because sometimes it doesn't seem like anything as a physician I could have done, but maybe we could have incorporated more screening, more checkpoints, more XYZ. So that is one area. The other area that's been interesting over the last couple of years is we've incorporated a lot more screening for discrimination, interpersonal racism screening, and how that might have impacted the death. A lot of our deaths are much higher in African American and Hispanic population than they are in white population in Connecticut. And so a lot of times as we're reviewing the deaths, you'll be able to see clearly this person may have experienced some type of racism or discrimination either during their care or afterwards, or even bias, and that potentially led to their death. It's going to be causational at this point because you can't completely find that, but there are some opportunities where you're like, this person came to the ER a million times and no one picked up on the drug use, or no one screened them, or someone dismissed them. And so I think that that's been one of the areas I've been able to help a lot, is to say, hey, no, this person meets all of these criteria for discrimination, for implicit bias, for racism, or, the nurse or the doctor, whoever may have written in the chart language that seems that they were maybe passing some judgment. And I think that that's been valuable because we can then look at how do we address those on a societal level so that we can make patients feel more comfortable. We can address their concerns in a compassionate manner. And so to that point, we make a lot of recommendations kind of concerning ways that we can impact the community. And so Connecticut Maternal Mortality Review Committee, after reviewing all the deaths, we make recommendations. And a lot of the recommendations so far will then be sent to the state. So I don't know exactly how many have been implemented, if I'm completely honest. I know that because of it, they've increased awareness and education to the different birthing hospitals in the state, which has been important. We've talked a lot about doulas and having doula care and access to doula care. And I know that there was legislation that's passed and they're working on implementing coverage for doulas in the insurance well. We have, partially from work from the MMRC, there's now a maternal mental health hotline, because a lot of deaths in Connecticut were kind of around mental health awareness and mental health conditions. And so we now have a hotline that any clinician who has a pregnant or postpartum individual can call this hotline for free and get advice on therapy or medication to help a person who's experiencing some type of mental health issue. And so I think that a lot of that work has come from what we are seeing in deaths and ways that we feel that we can make an impact on pregnant and our postpartum population.
That's all incredible, especially like the implicit bias screenings and racism screenings. I think that's a thing where I know most people think of racism as being potentially deadly, but I feel like you don't think of it in that context.
Mhm.
And that's so major that there's all of these things, but that's a thing that I think gets overlooked rather than like, oh, did this person get the wrong medication or did they not get a screening for this?
Right. It's like this person got the right medication, but years of discrimination or felt like the doctor wasn't listening to them. They didn't take their medication.
Right.
Or nobody screened them to see that they would even need that medication because they didn't feel like they would need it. Or, oh, this is, just the language that we're using there. It's a lot of colloquialisms, and how that's actually damaging to patients in the long run is a lot of what we are looking at. And there's some cases that look cut and dry until you really kind of go through with a fine tooth comb and you go, no, I can give you 4 instances where this was probably didn't need to happen that way. And then we can think about how do we change the language? How do we change the attitudes and behaviors so that people are treated appropriately?
So pivoting a little bit, one of the things that I thought was interesting about your bio was your interest in treatment for uterine fibroids and the method that you got trained in, like the new minimally invasive method. So fibroids, from a quick Google, learned perhaps incorrectly that they're more common in Black women. So just why is that a thing that's important in your practice, and what are the impacts of fibroids? Like, how do they impact your patients and Black patients particularly?
Yes, fibroids they're a huge burden to patients because they just cause a lot of symptoms between heavy bleed, heavy periods, sometimes painful periods. They can be disruptive to life for people. And, we didn't have a lot of great treatments for it. It was either hormone therapy or surgeries where you either take the fibroids out or you do a hysterectomy. And a lot of people didn't just like those options. Patients wanted more options, especially if they wanted to keep their uterus. And the reason I started to get interested in it, especially with this procedure, is because I encountered so many people who had fibroids and they're like, I want to keep my uterus, but I don't want to feel like this. And and I felt like my hands were almost tied. And then I heard about this new technique or this newer procedure. It's actually been out for at least a decade or more, but it was newer to Connecticut, where we can do a minimally invasive surgery to burn the fibroids. And by burning the fibroids, it helps to shrink them a little bit. It can help to decrease the symptoms people have, but they also get to keep their uterus. And I think that has been revolutionary for patients because they're like, when they come to talk to me, they're like, well, my doctor told me I could only have this thing done. And I'm like, well, let's talk about that more. And so what I love about this new option is that it allows me to really talk with patients about goal setting and really try to hammer in what is important to them. Because there are going to be people who are like, I just don't want it anymore, get rid of everything. And I think that that's okay. But for the person who says, I would like to keep it if possible, can this help? I can then have an honest conversation. We can bring in the data, we can individualize it to them, and then help to decrease the burden that these fibroids are having on their life. Allow people to be able to go back to enjoying it, not having heavy periods or painful periods, maybe impact their fertility in a great way. And I think ultimately, it's always about health outcome, but within the realm of what their goal is. Because for some people, the health outcome may be not having fibroids at all. It's a different procedure. For some people, it is just to feel better and to get back to their normal life. And so this procedure, my interest in it has, after I started performing these procedures, I've been able to really help people in their life. And I think it's wonderful. I still do the other ones. Don't get me wrong. It's not like I've stopped them, but for the appropriate person, it's allowed them autonomy, the ability to be involved in their decision and to really be comfortable with the decision that they're making.
That just makes me feel hopeful that there's, because it feels almost like women's health is done sometimes. Like there's not,
Correct.
right, you're like, there's only a certain amount of options, and it's only these things that we know have horrible side effects or are gonna like impact your fertility dramatically. So it's wonderful that there are options, and that, you are a person that people can come to and say, what options do I have, before committing to something that's potentially very life-changing.
Life changing, can take time off of work. That's how the discussion all goes. You're right. There's hope. I think the last 2 years we have not felt hopeful in women's health because so much has happened. It feels like out of our control, and then we get these little pockets of hope, which is what I can offer people, at least in this realm, especially with fibroids. There is hope, and I think it's only going to get better in the future.
So obviously you're involved in a lot of things outside of the scope of your regular practice. How do you deal with compassion fatigue, and how do you maintain passion for the work?
Well, that is an excellent question. I have a great support system. My husband and my family allow me the space to be able to do all my passion projects, but also the boundaries to know when I might be crossing the line. And I think that has been able to help keep me grounded. I don't try to, if I get requests for doing certain things, I actually do run it through my husband because he's like my master scheduler. And he's able to say, hey, you have all these other things planned. Can this really realistically work in? So that has been helpful to help with the fatigue. But I think I always have to go back to, why did I start this? When I ever get to the point where I'm feeling exhausted or drained, I have to remember that gynecologic organs are like my most favorite thing on the earth. And I could talk about them until I turn blue in the face. And I will probably die doing this job. And so I think that is what's kept this passion going. And I have to, recognize that there are certain seasons of life that I may not be as active as I normally am. Like when I had my children, I had to take a step back and focus on my kids. And then as they've gotten older, I'm able to branch out and do a little bit more. And so it really grounding myself in why I do this work. And then of course, I surround myself with people who love what they do also. And so it's helpful when you come to work and everybody is excited about doing things about the uterus or the cervix or the fibroids or ovaries. It makes me excited because I love what I do. Every day I do the surgery. It's just like, it's fun. And I think that's what keeps me excited. For my self-care routine, to that point, I have a day off every week. I love my practice. They have allowed me to do tremendous great work for the community. They've allowed me to have time with the patients to really get to know them. But I also have a day off where it's just for me. And if I choose to work on it, I will do that. If I don't, then I will do my own self-care, which may be lunch with a friend, and then doctor's appointments, or sitting in a park, or picking my kids up early and hanging out with them. It's that day off. I hoard that day like it's nobody's business, because that's what's been important. Like you said, I not only work, I'm a mom, I'm a wife, I do a lot of community things. Is the one day that I get to decide what I want to do. And I think that has been a game changer in keeping my fatigue level down, because I have a day that I can escape. I grocery shop on Thursdays. It's like I can't do it any other day of the week. It just won't work. And I like grocery shopping is therapeutic for me, as I am a stress shopper person. So that is okay with me. And my husband's okay with it. So yes, I agree with you. And if it weren't for my job even offering that as an option, I don't even know that I would have thought about it. So I advocate to every person. I'm like, I don't know how anybody works 5 days a week. Don't know it. And you know what? I don't need to know it, because that extra day is so life-giving. It allows me to give my full 100% the other 4 days of the week.
One of the things that was really lauded about your International Women's Day presentation was that you ended with a call to action about going out to vote. So I love how you speak about enabling patients to be their own advocates. So in your opinion, what are some things that people who are outside of healthcare can do to support efforts to improve Black maternal health outcomes?
So number one, educate yourself. I think that people going to community presentations, people read what I read. It's not like everything is accessible nowadays. Like the papers, the same information I have is not a secret anymore like it used to be. So I advise everyone, read on the papers, come to the appointments with the percentages. I read that it is 100% or this. That allows a fuller discussion. as well as to encourage events in the community to educate those around you. If we get community partners, loved ones involved that then speak to patients, it just empowers them more because there's a community loving on them and not just one person. I also think, especially if you're not the person going through a healthcare issue, advocating for your loved ones. I love when support people come to appointments and not necessarily speak up for a person, but go, well, what she isn't telling you is blah, blah, blah. And I'm like, why didn't you tell me that? And they're like, I didn't want to burden you. You're not burdening me. I need to know that. And sometimes we do that inadvertently. So advocate for your loved one to see what needs they may have, talk to them about their goals so that you can help them achieve your goals. Because I think that's how we're going to address this issue. If someone doesn't know that there's a problem and no one speaks up for them, I can't help them. And so I'd love for that. I ask if they need help. I mean, pregnancy and postpartum is a very interesting life or time frame. And so if someone needs help or you're noticing behaviors or, symptoms that seem odd, ask them or even bring it to the attention of their clinician so that they can ask them discreetly. There's some patients who there's things I didn't know and someone told me and I'm like, thank you for telling me. And I can figure out a way to incorporate it so I can get more information. And the other call is I tell everyone, become a clinician. It's not a secret. I mean, medical school is hard and long and all those other things, but there are so many other ways to help in the maternal health space. It's not just a doctor. There are people who become doulas. You can become a midwife. You can become a birth educator. You can become a nurse. You can become the mental health specialist. Just like we say, it takes a community to raise a baby. It takes a community to support a pregnant person. It shouldn't just rely solely on the pregnant person and their doctor or their midwife or their whomever. It takes a large group. And so I challenge everyone, get involved in healthcare, some way, shape, or form. You don't have to be a holistic expert in everything, but if you are an expert in your one little thing, you're going to do more for that person than I probably will, because I know obstetrics and gynecology like the back of my hand. Do I know anything about social work? No. And I could try, but I'm not going to be good at it. And so if someone else brings that expertise to the forefront, we can move mountains for patients. And I think that that's what's going to move mountains is everyone with their little silos finally coming together to surround that support that pregnant person and really help turn the tide in their outcomes.
Well, this certainly has made me feel a lot more optimistic.
Good.
Yeah, it's one of those things that I think the more you think about it, you're like, wow, this is actually quite dark. And like, especially in Connecticut, I don't think people really consider that there would be that big a racial disparity. And, in the US, like birth outcomes are way worse than they probably should be for how economically privileged and advantaged we are, just like as a country. So I think the information is shocking, but it's really inspiring to see all these people rally around the cause and push to make things better.
And the most recent data that came out from the CDC actually shows like the first time it came out last week that we still have high death rate, but we actually went down this year.
That's awesome.
2022, I think we actually went down, which is insane because it's been rising since 2018. So I think there is hope. I know it looks dark and, one death is one death too many. We are making strides. And that's why I think as people keep pushing, keep advocating, keep talking about it, our patients are scared and they're coming in already with this idea, hey, could this happen? And it's like, yes, how are we going to keep you safe is my next step. And I think we've proven that we can be better. And that's what I'm excited for.
All right. Well, thank you so much. That was a beautiful closer. Thank you so much for talking with me.
Appreciate it. Thank you so much. It was great to see you again.
This interview was recorded as part of our Ask the Experts section in the summer 2024 edition of Trauma Matters, our quarterly publication dedicated to disseminating information on trauma and best practices in trauma-informed care. Thank you for joining us on this special episode of Realizing Resilience. To learn more about Trauma Matters, visit us at womensconsortium.org/Trauma Matters, which will be linked in the description below. There, you can contact us to sign up to receive a copy, read a digital copy, or even apply to submit an article. Thank you for listening to Realizing Resilience, and we will see you next time.